Hi, good evening and good morning or good afternoon, wherever you are. Thank you all for joining our webinar tonight at USMLE-Rx, ScholarRx. This is our Path to the USMLE Success talk that we give a couple times a year, and we're delighted to have you on board tonight. I am your host and speaker, Tao Lee. I'm an associate clinical professor of allergy immunology at the University of Louisville in Kentucky in the US. I'm also better known to many of you as the senior editor for the First Aid for the USMLE series, and also the editor and founder and chief education officer for USMLE-Rx, which is our question banks, videos, flashcards, and ScholarRx, which is our digital curriculum platform, which also many of you know and use. So really excited to have you here tonight. We also have some facilitators working with us tonight. I've got Jeff Downing, who'll be here to answer your questions, and Louise Peterson as well too. So, again, if you have questions or comments, feel free to drop it into the question box, which is going to be on the right-hand side if you're on a PC, I think even a Mac, and it'll be on a different place if you're on your iPhone or Android device or an iPad or some other tablet. Anyway, we will keep an eye out there for the questions. And we, again, look forward to, chatting or, answering questions where we can obviously do that. And again, Jeff and Louise will take care of that in the background while I continue the presentation. So let's get going. On the very first page of First Aid, we have this one word, relax. This has been on all 35 editions of the book. And hopefully, going in the future as well too. But we put that there to remind you that preparing for the USMLE is a process. It's a marathon. It is not a sprint. You need to think about it. You need to be deliberate in your plan. You need to think about what you want to get out of it, and what does it mean to you. And we'll kind of go through those questions, during this presentation. So again, I just want to kind of set the stage for something that's more contemplative and deliberative, so that you can calmly think about, what you need to do for the future. So over the next 40 to 50 minutes, we will cover obviously the basics of the USMLE Step 1. We'll talk about some recent USMLE updates that involve the Step 2 CK. We'll talk about how you define your goals, timelines for study, how you approach the subjects, choose prep resources. We'll discuss additional study advice, and then at the very end, there is a raffle and a special offer, for all of you that could hang in there. So again, you need to be there, or at the very least, it'd be nice if you're there, so we can recognize you if you're the raffle winner. And then I said there's a special offer as well too. Then we'll open it up for questions and answer, and we'll try to look at the kind of the thematic or the most popular questions and see if we can provide broad answers. Now, what we won't be able to do is give very specific advice for your use case, for your particular scenario. There's a lot of people on this call tonight. Everybody is different. Everyone's unique. Everyone has unique needs, and unfortunately, we won't be able to answer specific questions. And so that's where we're at. So again, looking forward to having that discussion. All right, next. All right, so again, I may go through this rather quickly because a number of you folks are going to be taking the exam real soon. But again, slow me down because there is a fair chunk of you folks that aren't going to take the exam till next year, and so this may be helpful. So I'll cover it, but I might go a little more briskly since half of the folks are going to be taking it in the next couple of months. And may already be aware of certain things like the basics. Again, like the fact that this is a 1-day exam, 8 hours, 280 questions in 7 1-hour blocks. So that means 40 questions per block when you do the math. And if you're doing 7 hours, then you've got 45 minutes of break time. You're saying, well, wait a minute, where's the extra 15 minutes if it's 8 hours? It turns out they give 15 minutes for this orientation block. So you can see the blue blocks are the ones that represent the exam itself, and you'll take a lunch break or snack break somewhere in the middle once or twice, but there's 15 minutes here. Now, this orientation block is pretty much the same orientation block you'll get when you go to usmle.org and do their, their simulation exam, which you can do online. And uh, and so really the only reason to go into this orientation block at the Prometric Testing Center is to adjust the audio on your headphones. Once you do that, you immediately get out of there and you'll recover close to 15 minutes, maybe 14 minutes or whatever. And that adds to your break time. And so you should be able to close, to start with close to an hour of break time to, during that day. And you'll potentially get more if you finish other blocks early. And we'll talk about that in just a little bit. On the USMLE, there's really only one major question style, which is the single best answer. They used to have other types of questions, and you might have seen that internationally in some exams you've done, but it's also a single best answer. The majority, some of them have multimedia, so that means they may have audio sounds, they may have heart sounds, there may be heart auscultation. Almost all of the questions are scenario-based or case-based vignettes that have second order or third order reasoning or multi-step reasoning. So an example here, for example, would be this vignette where you have a 32-year-old woman who presents with a 5-day history of occasional double vision and bilateral ptosis. And then the question goes on to ask, what is the most appropriate diagnostic test? And so, the first thing you'll need to do is break down how many steps this is. One of the first steps you'll need to do, and you'll almost immediately recognize, particularly if you've already done any practice questions, that this is more than one step. At a minimum, this is a second order question or a two-step question, because the first question is not what is the diagnosis, which would make it a one-step question, but what is the most appropriate diagnostic test, for which you should have a good idea of what the diagnosis is based on this younger woman who has double vision and the bilateral ptosis. She basically has kind of eye finding symptoms, and it's all around the eyes. And when you think about that, the differential, starts to narrow. And in this particular case, this is most likely going to be something like myasthenia gravis. So it affects the rapid muscles or, around the eyes that can fatigue, therefore giving you double vision and the bilateral droopy eyelids, right? Now, you could argue that this could be something like multiple sclerosis, which also could happen in younger women, but that tends to be more unilateral in their finding, right? Versus, again, the bilateral droopy eyelids. And so when we consider that and we think that, hey, this is most likely myasthenia gravis, then what would be the most appropriate diagnostic test for this? And in this case, if you live in the United States, and of course that's where the exam is, or what's it based on, then the answer will be something along the lines of anti-acetylcholinesterase antibody assay. That's pretty much state of the art. The classic answer, and it's still potentially done in some parts of the world, is idrophonium, which is a short-acting acetylcholinesterase inhibitor, often called the Tensilon test, Tensilon. That drug went off market in the US a couple of years ago, but it's still potentially available in other parts of the world. So it still may be, a plausible test there. It's just not going to show up on the USMLE Step 2 CK as the correct answer anymore. So that's a two-step second order question. You will find that, on the exam that, on average, and I know everybody's going to get different forms of the exam, but maybe 25 or 30% will be first order questions. About roughly half will be second order questions, and then you'll have some scenario-based questions, maybe some third order questions, that type of stuff. But that's on average what you're going to see. But again, your mileage will vary because there are, who knows, 30 to 50 versions of the test. All right, so let's go to the interface itself. So the interface, is very straightforward, that you'll see at the Prometric Testing Center. This is a Windows-based PC, no fancy Macs there. Sorry, Mac lovers. And you can see here that, you got a simple interface that has the question, has the choices. Typically, it's going to be 5, occasionally be 4. Sometimes you get 6, rarely you get 7 choices. And then you'll have, clinical images or diagrams 15 to 20% of the time. And that you will see that you got navigation on the left side, navigation across the top, and as well as elements for calculators and access to tools like Calculator Notes, lab values, and so forth. Key thing is is this real bottom bar, because it tells you how much time is left in the block, and then with that you could lock the exam if you need to go use the facilities or whatnot, but the clock is still running, and then you can only when you're done, then only then should you end the block. While you are in the block, you can go back and change any of your answers. You can't do that after you leave, right? So just keep that in mind. The other thing is when you leave, if there is any time left in the block, it rolls over automatically into the rest of your day. So keep that in mind. Now, again, I'll just kind of put it out as kind of a pro tip. Even if you can't go back and change your answers, occasionally, and this is what students are reporting, occasionally, you'll find a similar question, or a question has a very similar stem, or in a couple of cases, the exact same stem, which is the case here, but a different question. And so keep in mind that you pay attention. Some of what you've seen here could still pay forward in a future block. Now, we don't know whether those questions are experimental or not. If you get it right, let's hope that it's not experimental. If you get it wrong, let's hope that it is experimental, right? So just keep that in mind. All right, let's talk about scoring and passing on the exam. And so as everyone knows, step 1 has been pass-fail for the past few years. Passing is currently at 196, and the mean as of 2021, 4 years ago, was around 231. And at that point, the standard deviation was roughly 20. As everybody's been aware, there's been a dip in the first-time pass rates for medical students and IMGs. So if you're an allopathic, osteopathic, it dipped a little bit, and dipped a little further last year. And also it had also dipped quite a bit for IMGs, but it appeared to stabilize. It dropped to 72 and then went back up to 73 last year. So hopefully this is the bottom. Like I said, this was higher pre-pandemic, and there's a whole bunch of conjecture and speculation about why that happened and all types of stuff. My money is on the fact that the exam went pass fail. And it changed the entire psychology of the test, just to state it very, very simply, and just made it harder for people to psychologically prepare, for the exam the right way. So, obviously happy to talk about that later, but that's my very simple, unproven theory. So, so they did release some data, and you can kind of see here that again the pass rate. Where it is for, this is MD first time takers. We'll look at that, and you can also see what the overall pass rate is once you throw in allopathic, osteopathic students, and then here's the data for IMGs as well too. And one thing to note here is that, let me see if I got it here. It's not here, but for the repeaters, as you'll notice, the pass rate is lower. Why does that happen? Well, if you fail the first time, then you were always on the edge probably to begin with. And so therefore, it's kind of a 50-50 shot coming back the second time, around. All right. Now, obviously this talk is about the step 1, but I'll just kind of say a couple things about the step 2. Step 2 CK now has emerged kind of as a new screening tool. Step 1 was the screening tool prior to becoming, pass fail back, in 2022. This is the mnemonic that we use to help signify the specialties in the United States that are very competitive and that tend to use, not tend, but almost assuredly use the Step 2 CK scores as a screening tool. So that includes radiology, radiation oncology, these surgical subspecialty O's, ortho, opto, otolaryngology, urology, aesthetic, which is plastics, and then dermatology. They often get 100, many applications per available position, sometimes on the order of hundreds. And so they're overwhelmed. They have to, unfortunately, resort to something like the Step 2 CK as a premium. So despite the fact that this Step 2 CK has limited predictability, it has some, but not a lot with regards to your future performance as a physician in the United States. The other thing we want to kind of make you aware of, and this was just announced very recently, is that they are going to raise the passing standard, for the USMLE Step 2 CK. It was 214. It is currently 214. It will rise to 218, as of next week. And also, for our Canadian friends, you're already aware that the Canadian accreditation system is splitting from the US accreditation systems. And so that will make Canadian graduates IMGs. And so they'll have to go through the ECFMG pathway, like graduates from other schools outside the United States, like whether it's Mexico or our colleagues from, South America or Africa or Asia. All right, so those are just some really quick updates. And again, this is just to show that, there continues to be a trend, in the national mean scores. And it's a combination of their test taking and students just, being smarter. And so as you can see, they're raising the pass rates, or the minimum pass score, to kind of keep up with this. And you see, when this exam first came out, when I was a medical student back in the early mid 90s, it was 170, and literally the average was around 200 at the time. Okay, excellent. All right, so let's talk about study strategies. And so we will, we recognize that you all have prepared for standardized exams in the past. And so you already have your learning preferences, you already have your routines, you may have your lucky charms and so forth. And so, so we want to respect that, certainly, but, later on, we'll talk about where the learning science is. And that may force you to adjust some of your, exam preparation habits, your study habits, and so forth. Other things that you need to think about are the studying characteristics of a subject. So certain, certain subject areas are organized different ways in terms of the knowledge frameworks and the knowledge in the logical relationships and so forth. So, for example, things like microbiology and pharmacology have structured relationships that are fairly repetible. Sometimes tables and flashcards help them, whereas things like physiology are very dependent on the subject area itself, and so you're going to have to use you might use things like mind maps to help follow through the logic of all that. You also need to think about the strengths and weaknesses of your curriculum, mainly in the sense that some of what you get taught are very USMLE oriented, and some may not. Now, that's not at all a commentary or judgment on the utility of that curriculum. They're all designed to make you great doctors wherever you are. That's obviously the purpose of what your deans and your course directors are doing. But there may be some variance with how well it actually prepares you for the USMLE. And so we're going to obviously focus on that. But remember, at the end of the day, you're here to become a doctor. You're not here to just pass the USMLE. USMLE is just a hurdle to get past. And then you need to think about the time that's assigned to a particular subject or a system. And, in recognizing that certain subject areas like pathology, we're going to spend a lot of time, hopefully at least half your time, because that's roughly half the exam. You'll be able to deploy, more varied preparation strategies because you have more time and space. Whereas if you're just doing something like neural anatomy or embryo or biostats, you're going to be much more constricted, and you're going to be doing it with more limited to a certain set of strategies. By the way, I want to shout out my team. They've been trying to give you YouTube of prior talks and so forth. So again, apologize again for those who have had audio difficulties, but hopefully those YouTube links will be helpful. All right. And again, it's posted in the chat, and I think they'll try to email it to everyone afterwards as well too, just in case. All right, next is we're going to talk about for 10 minutes or so, what are the types of things that tend to pop up on the exam thematically, all right? And I'm going to talk about, I'm going to do it from a disciplines perspective, but obviously this will apply to all organ systems, by and large. So let's talk about, what's high yield. And so what I can start by what's not high yield, which is gross, which depending on where you come from, they spend a lot of time on gross anatomy, but it just may or may not be super useful. But what is useful is all the clinical correlations and all the clinical relationships, among diseases and conditions and procedures that rely on anatomy, right? So if if you're in surgery with then they will be using certain landmarks and so forth. And so it's good to know those and how they apply. And so, by the way, that addresses one of the critical myths of the USMLE, that it is a basic science exam. True, a lot of the questions revolve around pathophysiology and basic mechanisms, but it's wrapped within a clinical context. And these clinical contexts, these clinical cases are legit cases. They're not completely contrived clinical scenarios that you would never ever see in your life. These are 10 by and large that could potentially show up in your clinic or your hospital or emergency room someday down the road if you're practicing medicine, particularly in the US. All right, so I mentioned earlier that there's a couple areas that are very discrete, so you don't want to spend some time, but there may be some low-hanging fruit in those areas, like neuroanatomy and embryo. You will see cross-sectional anatomy, but it's going to show up in the form of clinical images like CTs, MRs, X-rays and stuff like that, ultrasounds maybe. And so you need to kind of be able to identify anatomic structures in those modality. We also need to think about other subject areas like biochemistry. This is one of 2 or 3 areas disciplines that tend to be a little crammable. What I mean by crammable, again, is that there are certain subjects that have repetitive structure, logical structure, or knowledge structures, or relationships with the key associations or what they're trying to teach and so forth. This would be true of biochemistry, particularly with metabolic pathways. And so those can be crammable. Again, we do not recommend in first aid, and first aid would never recommend that you cram, for example, because this is based on 1.5 to 2 years of intense medical education, around the world, but when you're 2 weeks away from the exam and, short-term memory starts to become a factor, you might start, adjusting your schedule. So some of these cram subject areas can be put there. And again, we'll touch base on that a little bit later. The other thing I'll just kind of mention here at a high level is that, there are laboratory techniques that are not just relevant for laboratory diagnosis and clinical diagnosis, therefore, but also, it underpins how research is done, potentially bench research that provide these basic science insights that that underpin human functioning and dysfunction and how we treat human health and treat human disease and restore human health and maintain human health. And so these techniques are going to be tested. So you will see flow cytometry, you will see Western blots, and things like that show up either in a scientific laboratory scenario, or a clinical laboratory medical diagnosis or medical treatment or management scenario. All right. Micro is also one of those crammable subject areas again, because there's, again, a recurring framework for how they organize, particularly bugs. Right. So, with bugs, it's there's typical things like, what's the morphology of the bug? How's the laboratory diagnosed? What's gram positive? What's gram negative? What, where does it go? Right. What organs does it go to? How does it get there? How's the diagnosis made? What are the reservoirs? What are the treatments? Things like that. So those tend to be regularly recurring, types of questions, because a lot of bugs do they go through the same way, like classes of bacteria and so forth, and to some extent, classes of viruses as well too. A couple of things to keep in mind. Remember, it's not all just micro when we talk, and everybody tends to think bacteriology, but there's all these other areas like virology, parasitology, fungology, and so forth. And then, in a post-pandemic world, we all know how important the immune response is. Need to know the roles of vaccines, how it modulates the immune system, and also what happens with immunodeficiency. These are very rare conditions. They often don't show up. They end up in my clinic as a clinical immunologist and stuff like that. But you don't see a ton of these other than like things like IgA deficiency, which is more common. And but they represent a window to how the immune system works, and so therefore that's occasionally why they tend to show up a little bit more often than on the boards than in real life. Viral structures in immune. So again, that's part of the morphology of understanding what viruses do. It may feel numbing, but try to kind of then gauge the structures to the types of things like antivirals and what classes of antivirals work on what type of viruses based on how the viruses are both structurally organized and genomically organized. All right, pathology, as I mentioned, is half the boards, literally. So you cannot get around this. Even if you're just looking to pass, you're going to spend time here. And so with that, you need to know the hallmarks, basics of each disease. And if it's a common disease, then you need to know all the variations of how it can present as well too. Like for example, asthma, particularly in children, doesn't always present with shortness of breath and wheezing. Sometimes it's just a nagging cough, and maybe you think, just allergies or a sinus thing or a drippy throat, but it could be cough, air, and asthma, right? So there's certain things that you just got to keep in the back of your mind. So they may. So this is tricky. They may provide information through the age, gender, ethnicity. You've got to be, you got to think about, when you're presenting with these presentations, what gives you most variance. So hey, if it's chest pain and they're 80, it's going to be very different from if they got chest pain and the patient is 15, right? You're not going to be thinking as much myocardial infarction. You'll be thinking about other types of chest pain. Let's say if it's a tall, skinny kid who's 18 or 20, maybe somebody, and he's got sharp chest pain instead of crushing chest pain, then it may be, spontaneous pneumothoraces or something like that. So it's going to be, so you got, these things can't, you take these factors in, and you got to kind of cross it with the key presenting symptoms, and make a determination, about whether they're appropriate or not. And I don't know if we're going to have time here today, but we do have that's why we're very excited about these new clinical bricks that we have coming out. They're called clinical presentation bricks. They're actually designed to teach you that, like if you got a patient with chest pain, what are you thinking about? What does age mean? What does age have to do with chest pain? What does gender, sex have to do with, chest pain and stuff like that? What does it make more likely? What does it make less likely? That type of stuff. Versus looking at a bunch of random facts and trying to fit it all together. So we're going to have those clinical presentation bricks launching later this summer, and we'll be very excited to get your feedback on it. And while it's designed for clinical reasoning, as you can see, it can be very, very helpful on the USMLE Step 1, which does use some level of critical reasoning and certainly critical thinking, not just pattern recognition and memorizing gobs and gobs and gobs of facts, which obviously you still need to know, but it's how you put it together, how you decode the case, right? Trigger words, mnemonics, things like that, memory devices, those are all things that we do in first aid and other people do in application to kind of help you make memory associations, but they're not as helpful, on the exact, because you actually need to know how they're going to describe it. And so once you've done thousands of USMLE style questions, either from the NBME or from a Q bank, then commercial key bank, then you'll start to get those patterns about how they like to describe it, and you want to use that as well too. Pathology tends to have clinical imaging that goes along with it, so gross, photomicrographs, clinical imaging, particularly if there's pathophysiology involved. What we have found is that depending on how the item is constructed, the majority of the time you can actually answer the question with just the rest of the stem alone. Again, the stem being the case that they're presenting. The question is what's called the lead-in, and then you can use the imaging as confirmation. Never, ever look at the image first before you get through the case, because you've got no orientation. So that's the other pro tip there. All right, pharmacology is that third crammable area. Again, there are certain relationships that they tend to talk about, what regardless of the class of drugs. So it'll be like things like mechanism, toxicity. Indications have now been moved to step 2CK. You all know that. That's been true for years. But you still want to use the indication because it ties the whole story together, and of course you're gonna see this on the step 2CK soon enough for sure. On the exam, they tend to stick to prototypic drugs, most commonly, but you will see major variants, and you will on occasionally, and you will see obscure derivatives as well too. But hopefully those are experimental questions. You should never see trade names and dosages. So that's never worth learning, other than if you're using it as a mnemonic or another type of memory device. Okay. And again, because pharmacology is involved in therapeutics and management and so forth, it's often tied in to the pathology, the physiology, everything that's coming up before that. So again, think about how that's integrated. And so that's another theme I'll harp on, which is again, particularly for second and third order questions, you have to be able to integrate these what may initially appear to you as random facts that you're learning on your way through medical school into these cohesive pathways that in terms of how these things manifest and so forth, right? Like for example, if I said Krebs cycle, why should you care about the Krebs cycle? It might be challenging until you realize that Krebs cycle, abnormalities occasionally show up in congenital metabolic, disorders. So something that might happen in newborns and babies or young children, they tend to be super rare. So fortunately you won't see them, but that's you got to think about, where does this actually matter, in human disease, human health, and disease and therapeutics and management, what you can do to help that human heal, both physically and and mentally and so forth. And I guess that would be the other thing is like, think about how to integrate things, and then also think about how to apply everything. What is the clinical application for that piece of fact? People aren't giving you a bunch of random facts just for the heck of it. It does mean something, and on the USMLE it often does. All right, physiology, as mentioned, is concept oriented. And again, as I mentioned, diagrams often work well there, because you're thinking about the relationships between the different hormones and the glands and and so forth, like the HPA axis and things like that. And so again, it's all about those relationships. It's not as rigid and recurring as, say, the knowledge relationships or the conceptual relationships in areas like pharmacology or microbiology and so forth. And so again, almost all the time, that's why you'll see these in clinical vignette scenarios and integrate with pathology and genetics and other basic science or concepts. All right, psychiatry, is kind of a mix of psychology, sociology, psychopharmacology. We tend to think about mood disorders, but there are numerous other high yield areas that we touch on here, and that's also covered in first aid. And then public health. So classically, it's been seen more as biostats, ethics law. More recently, particularly with health system science, you'll see more healthcare delivery, patient safety, quality improvement. Biostats and epi tends to be super high yield, because it's kind of a fixed area. there can be a little bit of math involved, so you got to be ready to run, run a little calculation. Either you remember those 2x2 tables if you're calculating sensitivity, specificity, positive predictive value, negative predictive values, likelihood ratios, that type of stuff. The other thing that kind of gets folded in here are the doctor-patient interactions. We often call them the quote questions because they're often a scenario-based situation where you're the physician or you're the caregiver, and with a family or with a patient or a very concerned family or family member, it's often highly charged or whatever, and then they need help, or there's a scenario that gets posed, and then you have to reply in the form of a quote. You need to do this, or we need to do that, or we need to call so and so or whatever. So those are the doctor-patient interaction questions, and they've evolved those particularly over the last 5 years or so. All right, so that's kind of a high-level review of what may show up. Now, in the last 10, 15 minutes, let's talk about a couple other things. Let's talk about review resources. So there are a number of things you can use. There's text reviews, and good gosh, books are still around, but not that many, and first aid is still one of the last things you can use that's still worthy of being a book. Everything else has moved to digital. There are obviously question banks, video platforms, and digital card flash forms, Anki, things like that. Review recourse courses, they're all out there. And I think the key thing is not that there are enough resources. There's generally potentially way too many resources, and you've got to pick and choose what you think will be most useful for you. So we do have review resources. It's in section 4 for First Aid for the USMLE Step 1. So check that. We do advise that whatever you think you're going to use, get those early, whether the digital resources or the handful of books that you might use. And don't overbuy. I mean, most of these things are on demand. Obviously, all the digital resources are on demand. And even if it's a book, you can usually get that many places around the world relatively quickly, in a couple of days, if not more than a week or so forth. And again, like I said, if you make those decisions early, you're using along with your coursework, that type of stuff, particularly if you're still in medical school. You want to think that you want to be discerning, I think that's the right word, that one series may not be great for everything. So flashcards may not be great for everything, or, image mnemonics might not be great for everything. So it may be fantastic for certain things, but more difficult for other things. So think about what works, what not work. And, again, the section 4 and First Aid Step 1 with the ratings can help you with that. So, I've been talking for a while, and again, I recognize that a couple of folks can't hear us, and again, I apologize. But for the ones that have been able to hang in there, I do want to ask a question. I want to see, if what type of resources you are using or will be using to prepare for the boards, and it could be none of the above or all of the above. So take a look, and we'll talk about some of these resources in just a bit. So I'm going to give you guys 15, 20 seconds. And again, it does take a little bit of time to collate all the results. So just be patient as the computer does its thing. All right, I think we've got about roughly half of you folks voting. I'm going to wait for another 10, 15 seconds. Love to see if we can get up to 2/3, so we can have hopefully representative getting there. All right, we are at 2/3. We're actually at 3/4. Fantastic. So I'm going to close this. I'm going to share this, and let's take a look at the results together. So you see that the question banks top the list, followed by review books and videos and flashcards. They're all kind of like 1, 2, 3, or 2, 3, 4. And then AI at 40%. Interestingly, I did this talk just a couple of months ago and was at a lower number. My suspicion is that AI will continue to rise as the tools become better that use AI, and also as people get more familiar using AI as well. So thank you for sharing. I'm going to go ahead and remove that poll and continue. So let's talk about a little bit about some general study advice. So these are things that have been proven to be useful. We do talk about first aid and other places, and so keep this in mind. So one, establish a study schedule and stick with it. We, it often happens that we get a little nervous, we get a little anxious, and we despite our best efforts, we look around, we see other people doing different things, and then we change. Now, there are times where you need to do that, but anxiety-driven studying is not healthy. Do take some certain precautions that we're covering here. Get some advice from your academic success office or the student success office or the medical or the learning specialist. And do check with your upper class folks that you trust and who know you, and then have build flexibility in your schedule to accommodate for certain, unforeseen scenarios or foreseeable scenarios, and then you should be okay, and you should be adjust within the framework of your study schedule. You want to integrate and apply everything. Again, we covered that when we did this discipline, right? Because again, this gets to how do you handle second order, third order questions, and again, it gets to the point that everything is clinically applicable. They are not generally having you memorize things that would never have some sort of clinical healthcare human application. We mentioned the fact that short-term memory can be a factor in the last couple of weeks, before preparing for the board. So, if you have flexibility, you can put certain crammable subjects there, or at least for review. If biochemistry is occurring during the school year, please study your biochemistry weekly coursework. But when you scheduling for review, or when you're going through some cramming tables and stuff like that, that's where you can put all this stuff in the last couple of weeks. Medical school, is something where you should have learned quite a bit of stuff that is applicable to the exam. So focus what you learn in medical school and what is recognized as high yield, and then before you go to other materials. Make sure that you build in time into your schedule for breaks, exercise, personal issues, in the fact that things will go wrong for you, or could go wrong for you. Hopefully not at a major level, but maybe you did, maybe you took one of the NBMEs and you didn't do as well. So you need to focus a little on this subject versus that subject. So you need to have flexibility to adjust for the bumps and bruises and the fact that this is a marathon, and you want to recognize that certain times you'll be studying and sometimes you just need to have a break and be a human being. So for example, even in dedicated study period, so that's where you're doing nothing but studying like 7 days a week, or quote unquote full time. We strongly advise you still take a full day off if you can, at minimum a half day, or do 2 half days a week somewhere, so you can reset your brain and so forth. Also, make sure you get sleep. The science is clear. If you do not get enough sleep, you do not give enough time for your brain to process. So it's not just about recovering, which is true. You need to do that, but also the brain needs time when you sleep to process everything it's learned. So, what your sleep habits are. Make sure you are staying within that healthy sleep zone. Speaking of sleep, make sure you stay relaxed and grounded. We talked about this as really the guiding principle of the book. You want to stay grounded. You want to kind of keep the long view as you prepare for the exam. We do have this checklist that's at the front of the book. It's right after the acknowledges before section 1, that you can use to keep yourself on track for what to do years, months, and even days, weeks before the exam. All right, last couple minutes. CBT. CBT stands for computer-based testing. That's what the USMLE is. So we already talked about being familiar with the tutorial, which you can do online. Keyboard shortcuts may or may not be helpful, so I won't spend too much time, but they're there if you need it. And it's clear that you need to do, questions throughout. And, so people talk about self-testing. The science is clear. It's been there for many years, published in the journal Science. And also, it made the front page of the New York Times Learning Science, where people do retrieval practice, which is self-testing. They do better for direct questions, and they do better even for inferential questions where they're a little bit more complex, versus repeated studying, concept mapping, or just doing one steady thing, right? So self-testing, spacing of that, over time is what you should be doing, and not cramming it all at once. All right. Yeah. So in terms of self-study options, you do have the USMLE sample test, which is helpful for format familiarity. Obviously, many of you know that's a free 120. There are the NBME SSAs. There's about 5 or 6 of those floating out there right now. They cost about $40 to $60 depending on where you live, what part of the world you're in. And CBSA stands for Comprehensive Basic Science Self-Assessment. And they will give you a scaled score, which, then they'll translate that into a probability of passing, like high probability, low probability of passing on the USMLE Step 1. So it's useful for benchmarking. And then there are all the Q banks out there, like, of course, USMLE-Rx and, UWorld and AMBOSS and Kaplan and so forth. And those are obviously helpful for practice studying and prediction as well, too. They can also be used for simulation. We have the half-day self-test. So, self-assessment 1, self-assessment 2, UWorld and everybody else also has multiple self-assessments. So those are good as well, too. We also give you the option of doing a full day self-assessment simulation. So, so that you can get a gauge of how your energy level, can hold up during an intense full day exam. All right. Let's talk a little bit more about the cognitive research behind preparing for the USMLE. There's a couple of other things. I think, largely intuitive, but it's helpful. I think it's still assuring to know that there's data there. One is question banks are superior to flashcards. It's not that flashcards aren't bad, and certainly, we certainly have our Anki adherence here. But think about it. The Q banks look much more like the real thing. So that's very appropriate. And the logical organization of a clinical variant question is going to be different than that of a rote memorization flashcard, right? So flashcards are still important. You need to know the basic facts, but it's really more important about how you apply those facts. And that's where the Q banks really pull ahead versus flashcards. In the days before USMLE Step 1 was pass-fail, you would have to do roughly 300 or 450 Q bank questions, unique Q bank questions, to get one additional point on the Step 1 after controlling for MCAT and GPA. So doing questions does work. You have to do a bunch of them. And if you did all of USMLE-Rx, you can roughly get 10, 12. Actually now, because we have Step 1, Step 2, if you literally were able to do all of them, it could give you anywhere between 10 and 20 points on the exam. So that's almost one standard deviation. If you think about it. In the studies that have been done in the U.S., people who, basically the more questions you did, the better. At University of Michigan, they kind of tapped out at 3,200 questions. We don't think there's a theoretical maximum, but we do think there is a point of diminishing returns. And as I said earlier, it's really doing 3,200 unique MCQs. Again, this is from the University of Michigan study from several years ago. They were not able to see, a lot of gains from repeating MCQs. Now, you might want to repeat MCQs because you're trying to learn something. So you're using that. You're not using it for self-testing. You're doing it for, spatial repetition of just repeating facts. So it's just, encoding, retrieval. And so there's some value in that, but it's really the unique MCQs, because if you think about it, you're dealing with an unknown. Whereas when you're repeating an MCQ, you already know. A lot of times you already know what's going on, and you'll often get that question because you saw that question before, not because you actually knew the subject area. And then that often gives you a false sense of security about how you're actually going to do on the exam, which obviously would be bad. The last thing is, is that, first aid actually has been shown, at least in a couple of studies, to help you, improve the board. And again, probably the best study was, again, the Michigan study showed that three or more passes would, could significantly increase your USMLE Step 1 score, particularly if you are using with active learning methods, like doing like flashcards. And so, like, for example, in USMLE-Rx, we have a lot of these same facts and concepts tested as flashcards, so you can study it that way. All right. Lastly, let's talk about test day tips. You're going to be amped up that day, so be careful about stimulants. You're going to be in a cold office environment typically, so come in with layered clothing so you can adjust for cold or colder temperatures. Rarely is it. I've never really heard of people complaining about hot prometric centers. There are many ways to break down a question. I think I saw Jeff drop in a link for our question dissection lab there somewhere. Join us. We do those, I think, monthly, but we do have a methodology for doing it. But regardless of whatever your methodology, if it's a long question, think about doing the lead in first before you look at the distractors or your choices or work back through a fat complex clinical case. In terms of managing the clock, remember you've got 40 questions in 1 hour, so that's 90 seconds per question. We strongly recommend that you commit to at least a tentative answer within 70 seconds. And then what that means is that, if you get through that, then that means you'll get through, you'll roughly get through all questions in roughly 45 minutes, 46 minutes, and you'll have 10 to 15 minutes left over to go back and try to solve other questions where you were able to narrow down to 2, maybe 3 options, and then you go back, right? A couple of caveats there. You will run into questions that are not solvable. So we joke about those C reflex. So pick your favorite letter, whether it's C or B, and just use that. And hope that it's experimental, because there are numerous experimental questions on the board, and maybe that's one of them. And lastly, with regards to lunch, you think about things that won't weigh you down. That are kind of energy bars and things like that. Things like granola, whatnot, nuts and things like that. And think about snacking, versus like a full lunch to spread that out, during the day.